A 73-year-old man is brought to the emergency department. Imaging is shown. Which of the following is most likely present in this patient? A. Broca's aphasia. B. Wernicke's aphasia. C. Left dysmetria. D. Right dysmetria. E. Left hemiparesis. F. Right hemiparesis. G. Left homonymous hemianopia. H. Right homonymous hemianopia. I. Bitemporal hemianopia. J. Left unilateral mydriasis. K. Right unilateral mydriasis. L. Locked-in syndrome. I'll wait 5 seconds and then I'll start answering the question. So obviously I was a bit of a jerk with this question. I kept the vignette very short and I gave you a ridiculous number of answer choices. But the truth of the matter is a lot of the questions on the USMLE for this kind of question is like this. And something consistent I've seemed to have found doing the MBMEs is that I don't know if the guys who write the exam have some kind of secret contest going on where they try to find the most vague and unintelligible imaging that they can find to put on their questions. I would actually argue the image I chose here is pretty nice by comparison to some of the ones I've seen on the MBME. But anyway, obviously my goal here was for you to immediately recognize yourself that this is the circle of Willis. I didn't want to provide too much information for you because you should recognize this. It's very distinct. And they tend to give you pretty specific symptoms for a stroke or aneurysm in the circle of Willis. So right here, I kind of had that vague arrow there kind of pointing to what looks like an aneurysm at the anterior communicating artery. So the correct answer choice here is actually I, bitemporal hemianopia. So instead of going through these answer choices one by one, I think it's probably better I just put up an image of the circle of Willis here and kind of go through some of the high yield stuff they like to test people on. So on the top here, we of course have the anterior communicating artery, which is what this question was about. Bitemporal hemianopia from an aneurysm occurring here. Obviously because the aneurysm would compress on the optic chiasm. So for anterior cerebral artery and middle cerebral artery, you tend to remember those together because they both cause a weakness and sensory loss in the contralateral extremity, but for the anterior cerebral artery, it would be for the lower extremity, and for the middle cerebral artery, it would be for the upper extremity. And of course, in lectures, they like teaching this with that one homunculus image or whatever. Some of you might have picked answer choices E or F, hemiparesis, for this question, just because you were thinking, oh, maybe it's the anterior cerebral artery. But I didn't specify upper or lower extremity, so you could eliminate those answer choices on that basis. Even if you weren't thinking of an ACOM aneurysm, it still doesn't really make sense as answer choices. The other thing is that the middle cerebral artery occlusion can cause Broca's aphasia on the dominant side of the brain and hemi-neglect on the non-dominant side of the brain. In most of the population, the dominant hemisphere is the left side, so if the question doesn't specify and they tell you that there's a left-sided middle cerebral artery occlusion, then you would think of Broca's aphasia in that case. So posterior communicating artery, this is one of those things where you'll find this in the first aid as well, which is the concept that you need to remember that CN3 has its parasympathetic fibers on the outside and the motor fibers on the inside. So what that means is that if you have something like a posterior communicating artery aneurysm compressing on CN3, it results in the parasympathetic symptoms like mydriasis, and you might not get the motor function deficits, which is to say the ocular motor, extraocular muscle deficiency. Or to put it in simpler terms, they'll have the blown pupil, but they'll still be able to move the eye okay for the most part. Another thing I want to note about anterior and posterior communicating arteries is that when they test on aneurysms for these two places, sometimes they like to test it with the subarachnoid hemorrhage. So they might give you an image of a subarachnoid hemorrhage, which is like an image of it would be like a CT or something, and it'll look kind of like a starfish. And they'll actually give you the symptoms of the patient in the vignette, and you'll have to figure out if it's anterior or posterior communicating artery from that. Anyway, moving on to the posterior cerebral artery. Obviously, people instantly think of vision. Now, in the answer choices here, I just put left and right homonymous hemianopia. I didn't put macular sparing. And that's because there are MBME questions where they actually write it like this, and it ends up being the correct answer. So I would have it in mind that it's with macular sparing, but don't always expect it to be part of the answer choice. Superior cerebellar artery, mostly that's ataxia. They don't test on that one as much. Basilar artery, usually when you get this, you're thinking locked-in syndrome, so they won't be able to move, but they can move their eyeballs, they can blink. ICA, of course, you have the lateral pontine syndrome. So you'll have various facial nerve and CN8 symptoms. You'll have like hearing loss for CN8, and for CN7, you're going to have like ipsilateral paralysis of the face. You're going to have loss of lacrimation and salivation. You might have a reduced sense of taste, and you'll have an absent corneal reflex. For spinal artery, you're going to have the medial medullary syndrome. So you're going to have an ipsilateral paralysis of the hypoglossal nerve. So your tongue, when you try to protrude your tongue, it's going to deviate to the side of the lesion because the muscles on the side of the lesion can't protrude the tongue the way the side that's fine can. So that's why it looks like it's bending to the side where the muscle isn't moving. And then you'll have contralateral limb weakness and contralateral medial limnosus function loss. So obviously you'll lose things like discriminative touch, proprioception, vibration sense. The last one here is posterior inferior cerebellar artery pica, and that causes lateral medullary syndrome. And just off the top of my head, this feels like the one they've tested the most. But anyway, this is also known as Wallenberg syndrome. You'll have ipsilateral facial loss of pain and temperature, ataxia, and they're almost always going to tell you that there's hoarseness or dysphagia. And it's also contralateral pain and temperature hemisensory loss. And as for the last thing I didn't really mention, which is that Wernicke's aphasia actually also gets caused by middle cerebral artery occlusion a lot of the time, but they're not going to test you on which specific artery causes Broca's and Wernicke's. They don't really test these that way. Anyway, that was a lot. I know that's a lot of stuff, but that's just how it is because you got to know these cerebral Willis, strokes, and aneurysms really well so that you can answer them very reflexively because they seem to like giving really bad images, like I said, so you need to be able to work within that limit. Anyway, I hope you found this question useful, and I'll see you next time.